Hello, everybody. Today I wanted to take a moment to reiterate the importance of health precautions and reporting procedures during the COVID-19 response. As many of you know, all installations across the Department of Defense increased to Health Protection Charlie on March 25th to help prevent the spread of the coronavirus. In addition to vigilant home, office, and personal hygiene procedures, another very important element is how we, as reservists, need to accurately report COVID-19 illness. Integral to this fight is our Surgeon General team, made up of medical subject matter experts working tirelessly for the Air Force Reserve community. While I could pretend to be the healthcare expert in this video, I prefer to bring in the real expert, our very own world-renowned Air Force Reserve Command Public Health Officer, Lieutenant Colonel Jessica Dees. She's going to share with you the real deal on what you need to know and what you need to do during these challenging times. What I don't have to pretend about is that COVID-19 is a destructive adversary. We all must fight it with every preventative weapon in our arsenal. Thus, now I'll turn it over to Dr. Dees to share how we can all take better care of ourselves and each other.
Today and for the foreseeable future, disease is our enemy, but we are equipped with the right tools for this fight. Every one of us has the ability to decrease the spread of COVID-19, and together we can flatten the curve. Non-pharmaceutical interventions will be key to winning the war on COVID-19. The Centers for Disease Control and Prevention continue to stress the importance of staying at home as much as possible. When there is a need to go out for essentials, practice physical distance of at least 6 feet away from people and wash your hands or use hand sanitizer as you leave your location. Wash your hands as soon as you are home. Keeping your hands clean as much as possible cannot be stressed enough, especially before eating. Avoid touching your face, specifically your eyes, nose, and mouth. Cover your mouth with the crease of your arm when coughing or sneezing and disinfect frequently touched surfaces. If you're sick, it's critical that you stay at home and minimize your interaction with other people, to include your family. The CDC recommends using a face mask if you are sick and around other people, or if you are caring for people who are sick. We recommend routinely visiting the Centers for Disease Control and Prevention website for updates and informative tools to better assist you. The United States is experiencing exponential growth of COVID-19 cases. As a result, the potential for our Air Force family to become infected with COVID-19 increases. We want to ensure every reservist understands the importance of reporting if diagnosed with laboratory-confirmed COVID-19. The COVID-19 pandemic has a potential to impact readiness, and as such, we each have a duty to report a change in health status. Now, more than ever, it is important to immediately report, as Air Force and Air Force Reserve leaders must continually assess total force impact. Our regulations even mandate this. Per DODI 6025-19, individual medical readiness, service members, regardless of in-duty or non-duty status, are required to report a change in health status. Therefore, active Guard Reserve members, traditional reservists, which includes Air Reserve technicians, or individual mobilization augmentees, must immediately notify their commander if diagnosed with laboratory-confirmed COVID-19. It is highly encouraged that Air Force Reserve members notify their commander if dependents have been diagnosed with COVID-19. It is also highly encouraged for DoD civilians and contractors to notify their supervisor if diagnosed with COVID-19. Commanders at Air Force Reserve host installations should route appropriate information regarding a laboratory-confirmed COVID-19 case to the installation command post for official reporting. Commanders at Air Force Reserve tenant organizations should route appropriate information regarding a laboratory-confirmed COVID-19 case to the host or tenant command post for official reporting. Specifically for individual mobilization augmentees, regardless of being in duty or non-duty status, IMAs should notify their active duty commander or appropriate chain of command if not assigned to an active duty unit, if diagnosed with laboratory-confirmed COVID-19. If your IMA notifies you of any confirmed COVID-19 diagnosis, contact your installation military treatment facility and your IMA's detachment commander. Protecting the health of our force is of vital importance today in ensuring the readiness mission continues. While disease is our enemy today, by implementing preventative measures together, we can ensure it is not our enemy in the future. Empower the fight, disable the disease.
I want to ensure our Reserve Citizen Airmen and their families are getting the true, correct facts on COVID-19. As I said before, and will continue to say as many times as it takes, as your commander, taking care of Americans, Reserve Citizen Airmen, and our families is my #1 priority, especially during this global pandemic. Be fully prepared to do your part in continuing to execute our ultimate mission, taking care of Americans. Aim high, Airmen.